Hey everyone, Dr. Charlie Johnson, physical therapist here, and in today's video I want to share with you some day-to-day tips and strategies that you can use to continue to and or start to find relief from piriformis syndrome. So in a previous video I talked about how everyone out there is telling you to stretch it, to do pigeon poses, to do piriformis stretches, to foam roll it, massage it, deep tissue it, hypervolt it, whatever these crazy massage machines are that I think are just a waste. But anyway, point is that a lot of the treatment is geared towards trying to stretch it, to lengthen it, to improve the flexibility of it, and or another way to say it is to compress it, right? So sitting on a massage ball, something like that. I kind of went against that and said, hey, no, let's go ahead and let's shorten this thing, right? So this is actually just further straining already strained tissue, right? So why don't we just relax it and improve the capacity for it to do work? Basically make it more bulletproof, improve the tolerance of the tissue to load rather than just continuing to tick it off, right? So with that being said, I sort of said this in the last video, but I want to expand upon it. There are certain positions or movements that are likely aggravating your buttock pain and or leg pain. We'll call it piriformis syndrome, right? And those things, right, the things I alluded to, are things that further compress or stretch out that area, all right? So this is likely the environment that you're in if you're trying to heal, right? So get that. For any given problem, there are often things that make it feel worse, so we'll go the frown face, and there are things that make it feel better. The first step in healing from any problem, I don't care where the pain is that rather than just going to look for the exercise, although it helps a lot of people, you need to understand the environment, right, and all the things that are influencing or making that pain worse and better. So you need to get in touch with your pain. So I would say right now, if you have piriformis syndrome or whatever it is, right, you want to write out all the things that are making you feel worse and all the things that make your pain, numbness, and tingling better, all right? So let me just walk through a few of these things. So often, people say, well, here's the thing. This is like a double-edged sword. So that says stretching. So they say, well, it hurts so good. So it kind of is something that makes you worse, right? But then it's kind of something that makes you feel better. So it can be a little bit confusing for people, and that's why people keep going down that road, because it feels like they're tight and they just want to stretch it out, but then they're watching my video, right? So stretching, you could put on both ends, right? Sleeping is often a problem. We'll talk about that. Sitting, maybe driving, right? All of these things. So there obviously can be other things that make it worse, but these are common things. Standing too long at work is another thing, or wherever, doing dishes, holiday cooking, whatever it is. So we're going to review each of these things, right, and talk about how you can sort of modify these things. So first things first, just stop stretching. That was, the title of my other videos. Stop stretching, start strengthening, meaning stop trying to lengthen this sucker and just, let it chill. Take the tension off of it. So stop stretching, that's an easy solution there. All right, you don't need to stretch. Your body just thinks that you need to stretch, all right? Sleeping, you do need to sleep. So what do we do about that? The answer is not to just, not sleep. The answer is to modify it, right? So you're gonna take all these things that are starting to fire, we'll call it, right? And do modify, tweak, or do less of them temporarily, right? Such that you can calm the fire down and then shift or tip the scale to healing, right? So sleeping, the big problem with all these positions is that it puts compression, it's sort of silently stretching your piriformis out. So if you're sleeping, a lot of times you're on your side and your leg is in a funky position, kind of falling over your body, right? And that can cut off blood supply to the tissue. So, picture this as a hose, right? Now if I took that hose and it could stretch, you can imagine that it would sort of cause some compression or put a little bit of a kink in the hose. The water, or in this case, the blood flow, is not going to move as well to the tissue. Therefore, you cut off oxygen and you cause pain because you're basically choking out the tissue, in this case, your buttock, which could include your nerves, your piriformis, your hip joint, whatever, right? So if you're sleeping and you got that weird position where your legs falling across, you need to stack a little bit better. So you need to, MacGyver or put a pillow in between your legs or something such that when you're laying on your side, your feet are, or your knees are sort of parallel to one another, not collapsing in on one another, right? They do make these little pillows, you know, where your knee can fall in them, and they have like a little sort of garter belt type of thing or whatever that goes around the leg so when you roll it doesn't fall off. Definitely recommend trying something like that, or first just trying a pillow on your own, right? So do the best you can there, all right? Now, sitting. So a lot of people with piriformis or hip sciatica problems, they don't realize it, but they cross their legs all the time, and it's a habit that they have a really difficult time breaking, all right? So you really want to be aware of avoiding crossing the legs, because again, as you cross it over, you're at a very low degree, right, stretching the tissue on that side of the hip. So no more crossing the legs. Again, to you know, maybe give yourself some input or some feedback there. Put this pillow, stand it upright between your legs when you're sitting at your chair for a day, all right? It may seem a little weird, but it'll work, right? Because every time you go to try to cross it, the pillow is going to fall, or you're going to bang up against it, and you're going to say, no, don't do that, right? Driving, standing. Let's talk about standing, right? So standing is often a problem for people because what they do is they don't generally stand with equal weight bearing. So picture I'm standing here, right? You know, in a perfect world, you have 50-50 weight bearing. 50% of your weight on one leg, 50% on the other leg. But what you see is naturally, as we've been standing for a while, we're using more standing desks, things like that, we shift our hips, right? So we start to kind of put more weight on one side. And if you can imagine, if I shift all my weight onto this hip, you're kind of rounding the tissue on the outside of the hip. Again, you're putting a low level of compression through the hip, through the muscles, through the tendons and nerves in that area, and it can make it annoy, right? So what I would say is adopt a slightly wider stance, right? And stand like that. So in that case, right, if you adopt a wider stance, you're actually shortening the tissue on the side of the leg, all right? So there you have it. Again, you want to do less of what makes you feel worse, more of what makes you feel better. You know, the exercises for piriformis syndrome in another video that I have are great, and a lot of people are finding relief from them. It's all based off this simple premise, though, of stopping stretching. So stop compressing, stop lengthening, stop trying to stretch out annoyed tissue, right? And instead give it some relief by shortening it, right? But understand that in conjunction with, or in addition to those exercises, realize that to some extent when you're sleeping, when you're sitting with your legs crossed, and when you're standing and kind of, you know, standing on one hip kind of funky, you are sort of stretching things. So not only can you stop physically what you would call stretching, but you can stop putting tissue in your hip in a lengthened state throughout the day. So hopefully this is helpful. Let me know if you have any comments, questions below. Would love to help you out. Thanks so much.